Dr. Michele, one of the services that you provided earlier is thermography.
Mm-hmm.
Talk about what that is.
Okay, well, thermography, for those that have never heard it before, it's been around for a very long time. People think that it's a new technology, but it's not. And it's imaging with an infrared camera. So much like they use in military where they see warm bodies in cold buildings and all that kind of stuff. Same philosophy, if you will, different type of mechanics when it comes to medical thermography. The same type of a camera, same concept. In fact, we have a lovely example of it right here. So these pretty colored pictures are what we would call thermographic images. And mainly, this process is used today with regards to breast tissue. And you see we have a couple examples of that up at the top. It actually predates mammograms by many, many years. And the number one question today is, does insurance pay for thermography? And unfortunately, no, it does not. Medicare did pay for thermography up through the 70s, and then they quit when mammography became popular. But we can see lots of different things with regards to thermography. We have some leg images here where we see blood pooling or varicose veins in this patient, undetectable by the naked eye. And so this patient was not aware of this issue, but was very illuminated by the images that we were able to see. This picture down on the right-hand lower corner is an individual's face, and I don't know how well they'll be able to pick it up in the video, but there is a black cold spot above this individual's eye. I guess it would be the right eye. And so cold, black as the spot is a cold indication, and white, if you look at some other areas here, white is as hot as it gets, so that's really, really hot. This individual was found to have a blockage above what they call the supraorbital artery, or in the supraorbital artery, which is fed by the carotid artery, which is in the neck. And unfortunately, the individual was told to take the picture to one of his doctors to let him know that the individual that took the thermogram thought he was going to have a stroke. The doctor didn't believe in thermography and threw it in the garbage can, and this individual died of a stroke 30 days later. So it does have a lot of great attributes in terms of what it can tell a patient in terms of inflammation and blockages within their body. And like any screening tool, thermography is not diagnostic. No screening tool is. The only way to diagnose pathology is through a biopsy. But this can give you great insight into inflammatory markers in your body. And they say a picture's worth 1,000 words, right? I can sit there and have a consult with the patient and tell them that they have inflammation, even based on lab reports, and it still just doesn't mean as much as when they see a picture such as this, and they're able to really realize that they are inflamed. And it oftentimes is what helps them to move forward in a program where they begin to eat a little bit better, get more exercise, hydrate better so that their body is eliminating. But with breast tissue, what we know about thermography is it can detect anomalies or things in breast tissue that may be bad tissue growth 8 to 10 years before a mammogram can pick up on any structure. So in order for, and I'm going to go ahead and put this picture down, but in order for a mammogram to show a structure in a breast tissue, that structure or that cell growth has to have been replicated for 8 to 10 years in order for the mammogram to pick up on anything. Well, a thermogram can detect changes, physiological changes in the body in years too. So it really, in terms of giving a woman the head start on her breast health, thermography is a much better way. There's no downsides to thermography. There's no radiation, there's no compression of breast tissue, nothing touches the breasts. For me, there's only an upside, okay? With mammography, you have ample radiation year after year, which is sitting in the tissues, recirculating, because most people are too sick to detoxify. And I make that statement not pointing at people that have diseases, because you don't have to have a disease to be toxic, okay? You'll eventually get there if you don't detoxify, but you don't have to have outward signs of being sick to determine that you're toxic. If your body is overburdened and it cannot remove the radiation, then it will recirculate in your tissue. And for those of you that don't know, I can tell you, and you can verify this, radiation does cause cancer. So overexposure year after year after year after year. And of course, mammography is not the only way we get exposed to radiation, correct? There are other forms. We can go to the dentist and get exposed to it through x-rays. We can go to the chiropractor and have x-rays done. We can have a CT scan. We can have a PET scan. We can stand in front of a microwave oven and receive different forms of radiation. So, you know, we're being bombarded from all sides. And for me, I have to question why we would ever screen for cancer with something that causes cancer. It makes no sense whatsoever to me at all. It really blows my mind. And furthermore, there are those that recognize that mammography is a part of the problem, that breast cancer is so pervasive and on the rise. When mammography came out as a screening tool, they told all of us that this was going to be the saving grace, that it was going to help reduce the incidence of breast cancer. That has not happened. So we have to move in a different direction. We have to. In order to save women's lives. And, you know, that's why I use it here in my office, because I do focus on women's health, and that's a very large portion of women's health. And I help them to navigate the reports and to educate them on the processes of breast health in terms of the things that they can do to make changes, physiological changes, which they will see in subsequent scans.
You've been interviewed several times by people citing your expertise with thermography, especially during October, November period, where there's breast awareness campaigns. Mm-hmm. Talk to me a little bit about how you became involved in that process.
Well, I've been doing thermography now for about 4 years, and I think it's just been more a process of people becoming acclimated with what I do here in my office, getting to know me. I've written a couple of articles. I have been interviewed on quite a few radio stations with regards to the topic. I was interviewed on a TV station up in Tampa. And really, for me, it's not about it's nice that people learn about me and what I do and that I'm here. But for me, doing those things is really about educating women in general about the processes, because I just really think that women are so ill-informed about their breast health and what is needed in order to secure their health in that regard. And so, I mean, that's just it for me. I just recently wrote an article for a magazine, a health magazine that will be coming out in October. And, you know, I mean, all those things are really exciting for me because it does give me exposure. But at the end of the day, that article is being distributed in many different states, not just here in Florida. And so that's more important to me because it's the educational value that is affecting many women across the United States, just not here where I'm actually going to impact them. There are many thermographers all over the country that can help people. And some of them better than others, quite frankly. There are a lot of thermographers out there that are not licensed healthcare practitioners. I always educate my patients that if you're going to pick someone to give or to provide that service for you, that you need to look for someone that can actually support you on the backside. Unlicensed individuals, although they may know how to operate a camera, cannot support people on the backside. The other issue would be the caliber of equipment that they're using. I'm completely automated in my office, and I have up-to-date equipment with the highest definition available on the market today. Many thermographers out there are using older equipment with lower density images, not providing as much detailed information. So you just have to be aware of those types of things. And price varies depending on what types of systems they have. But when it comes to your health, do you really want to pinch and save pennies? I don't know.
Would this be a reason for someone concerned after they've listened to this video or read something else that causes them some concerns about mammography to call and visit you for a 30-minute consult? Would that fit within a 30-minute consult?
Absolutely. Be happy to show them the thermography suite and show them some images and explain what it is that we are seeing and looking for. I would be happy to do that because to me that's again more of the educational process.